Hello, I'm Dr. Jeffrey DeSarbo, and welcome to the February 2010 edition of the Eating Disorder News Network. Many treatment providers have often held that target weights are too arbitrary of a means of measure when it comes to determining a return to physical health in patients with anorexia nervosa. Target weights often lack reliability and validity as well. The Department of Radiology at St. George's Healthcare Trust in the UK performed pelvic ultrasounds on 72 female adolescents with anorexia nervosa and compared published parameters of pelvic maturity to recorded weight for height ratios and BMI of patients with anorexia. Researchers found that there was a wide variation in weight for height ratios and BMIs at each grade of pelvic maturity, supporting the notion that the primary arbitrary targets for weight and BMI are likely to be too high in some patients and too low in others. Based on this finding, researchers suggest that target weight gain would be better based upon baseline pelvic ultrasound and follow-up screenings than on published charts. To further understand why eating disorders are associated with abnormalities of body image perception, researchers at the Hiroshima University Health Center in Japan investigated the functional abnormalities in brain systems during the mental processing of negative words concerning body images in patients with eating disorders. Brain responses to negative words concerning body images and neutral words were measured using functional MRI in 36 patients with eating disorders and with 12 control subjects. Participants were instructed to select what they felt was the most negative word from negative body image word sets and to select the most neutral word from each neutral word set. Compared to the neutral word set task, patients with both types of anorexia nervosa, restricting and binge purge type, showed greater activation of the right amygdala, while patients with binging behaviors, both the bulimia group and the binge purge anorexia group, had significant activation of the left medial prefrontal cortex. It is suggested that these brain's activations may be associated with abnormalities of body image perception, as activation of the amygdala may be involved in the fearful emotional processing of negative words concerning body image and strong fears of gaining weight. While researchers pose one possible interpretation of the finding of the medial prefrontal cortex activation, being that it may reflect an attempt to regulate the emotional response invoked by word stimuli. An interesting case report out of Istanbul, Turkey, reports on a case of a patient with anorexia nervosa who failed treatment with conventional approaches, including psychotherapy and pharmacotherapy, but showed recovery after having anti-reflux surgery due to esophagogastric complications. As a chronic disorder, anorexia can overlap with esophageal sphincter failure and delayed gastric emptying, which results in patients with eating disorders having a higher incidence of gastrointestinal complaints, including conditions such as gastroesophageal reflux disease, or GERD. The overlapping symptoms of these disorders may cause problems in differential diagnosis and treatment decisions. The researchers remind us that when dealing with patients with symptoms of eating disorders, physicians should keep in mind that these patients may have serious esophagogastric complications that can affect the response to psychiatric treatment. Alternatively, some patients with primary esophageal disorders may present with symptoms that can mimic eating disorders. Australian researchers examined the features of women with bulimic-type eating disorders attending primary care settings in 2 smaller urban regions of the United States. Among the findings was that although 2/3 of participants recognized a problem with their eating patterns, less than 40% had ever sought treatment from a health professional for an eating or weight problem, and only 1 in 10 had sought treatment from a mental health specialist. Additionally, only 1/3 had ever been asked about problems with eating by a primary care practitioner or other health professional. However, more than 80% had sought treatment from a health professional for symptoms of anxiety or depression. Most reported some degree of discomfort in discussing eating problems with others, and half reported that they would not be truthful about such problems if they were asked. Having an eating disorder was associated with several chronic medical conditions, including joint pain, gastrointestinal problems, and fatigue. And although larger studies are needed for confirmation, the findings suggest that the health burden of the bulimic-type eating disorder is substantial but remains largely hidden. A study in the journal Psychological Medicine points to the frontal lobe when looking at executive functioning in patients with body dysmorphic disorder, or BDD. With only a few studies of neuropsychological functioning having been conducted, some previous studies have indicated executive dysfunction in BDD. This study sought to further define these executive deficits using 14 patients meeting DSM-4 criteria for BDD compared to 14 age and sex match control participants. All participants completed executive function tests including spatial span, spatial working memory, the Stockings of Cambridge test, the pattern recognition test, and a test of visual memory. The results of this study indicate that patients with BDD have executive functioning deficits, including making more errors and slower thinking times in online manipulation, planning, and organization of information. However, spatial memory capacity, motor speed, and visual memory were intact. Research associates these findings with dysfunction in the frontal lobes of the brain. A group of Italian researchers looked at the efficacy of zonisamide, an anti-seizure medication that also promotes weight loss. In clinical practice, zonisamide has also been used off-label for management of binge eating disorders since case reports and small studies have shown potential for reducing binge eating behaviors and controlling weight gain associated with these behaviors. Researchers evaluated the efficacy and safety of zonisamide as augmentation to individual cognitive behavioral therapy, or CBT, in the treatment of binge eating disorder patients. 24 patients were enrolled in the CBT treatment group and 28 patients in the CBT group plus zonisamide group. Measurements were taken at the beginning of treatment, at the end of treatment, and 1 year after the end of treatment. Patient BMIs were measured, and the Eating Disorder Examination Questionnaire, Binge Eating Scale, Beck Depression Inventory, and State Trait Anxiety Inventory were administered. Results of this study showed that at the end of treatment, the CBT therapy plus zonisamide group had a higher mean reduction of body mass index with improvement on the Eating Disorder Examination Questionnaire, Beck Depression Inventory, and Binge Eating Scale scores. Follow-up at 1 year further showed that the CBT group regained weight while the CBT group plus zonisamide group reduced their body mass and showed even higher reduction in binge eating frequency and on the Binge Eating Scale, Eating Disorder Examination Questionnaire, and State and Trait Anxiety Inventory scores. And finally, out of Massachusetts General Hospital and Harvard Medical School and published in the journal Endocrinology Development is a report on anorexia nervosa and the characteristic alterations of multiple neuroendocrine axes and peptides that signal or regulate energy intake. Nutritional deficiencies and imbalances result in several changes to hormones. These alterations include a state of hypogonadotropic hypogonadism, a nutritionally acquired resistance to growth hormone with low IGF-1 levels, relative hypercholesteremia, thyroid hormone levels that commonly show low total T3 despite normal TSH, low levels of leptin and insulin, and elevated levels of ghrelin, peptide YY, and possibly adiponectin. Although many of these changes are adaptive to low weight, they can impact bone metabolism. Body composition, reproductive function, and statural growth can also be affected. Low bone mass is characteristic of anorexia in both adolescent boys and girls. However, some unique gender differences are noted. In girls, sites of trabecular bone, which is a spongy network of cells in the interior spaces of bone, are more likely to be affected than sites of cortical bone, the hard outer layer of bone. Whereas in boys with anorexia, sites of cortical bone are more commonly affected. Important predictors of low bone density include nutritional factors, body composition, hypogonadism, low IGF-1 levels, elevated cortisol and peptide YY levels, with possible contributions due to low insulin. And as reported in the article, weight gain is associated with stabilization of bone density, although residual deficits persist in the short term and in some cases long term. Check in next month for more updates in the field. And for more information on the reports mentioned today, see our references at the end of this newscast. I'm Dr. Jeffrey DeSarbo for the Eating Disorder News Network, wishing you a happy and healthy day.